true. Today, we are drawing a hard line between ancient tradition and modern scientific reality. Our goal? To build a solid framework that helps you separate fact from fiction and make truly informed decisions.
Okay, let's dive into this. I want you to really think about it for a second. How much of what we believe about the herbs sitting right there in our pantry is actually supported by hard, scientific evidence? Think about your morning supplement routine. Did you start taking those capsules because a rigorously peer-reviewed clinical trial suggested you should? Or was it because a slick marketing campaign or a traditional anecdote told you it was healthy? Today, we're looking strictly at the evidence.
Here is our roadmap for today. We're going to contrast tradition with scientific reality, bust some major herbal nutrition myths, and look at hard clinical evidence and case studies. Then, we'll uncover some hidden risks, give you a pro framework to evaluate claims on your own, and finally, look at the evidence-based future.
All right, Section 1. Tradition versus scientific reality, the evolution of knowledge. Let's talk about how our understanding has actually evolved over time.
For literal centuries, humans have relied on plants for health and survival. It's a rich, incredible history. But to validate that traditional knowledge today, we have to follow a strict hierarchy of evidence. It's kind of like a scientific ladder. We start at step 1, which is traditional use. This is basically the historical belief that a certain plant does a certain thing. To actually prove it, though, we move to step 2, lab studies. This is where scientists isolate specific compounds in a petri dish to see if they have a biological effect in a tightly controlled environment. And finally, the gold standard. We must reach step 3, clinical trials. This is the crucial moment where a traditional belief actually evolves into a proven clinical interpretation inside the human body.
Moving on to Section 2, busting herbal nutrition myths, expectation versus reality. It is officially time to dismantle some of the most widespread misinformation sitting right there on your store shelves.
The absolute biggest myth out there is that natural means always safe. And guys, this is fundamentally false. The reality? Natural products can have very real side effects. Just because a label slaps the word natural or organic on a bottle doesn't grant that herb a magic pass to bypass your human physiology. Not at all. These plants contain active compounds that have distinct, very real pharmacological impacts on your organs. Nature creates incredibly potent chemistry, and we literally have to treat it with the exact same respect we'd give to any synthetic active compound.
Now, what's really interesting about this slide is how it tackles another incredibly dangerous myth, the idea that more is always better. You know the logic, right? If a little bit of an herb is good for me, a massive handful of it must be amazing. But actually, pharmacology relies heavily on the dose-response relationship. Your body operates on a biological curve, meaning there is a very specific optimal window for efficacy. Taking way too much doesn't just waste your money, which it definitely does, but it can actually overwhelm your system or even lead to toxicity. Efficacy isn't about volume, it's all about precision.
And then there's the detox myth. You constantly see marketing for detox teas and herbs that magically cleanse your body of all toxins. Well, the clinical reality? Your body is already equipped with a highly efficient, incredibly sophisticated detoxification physiology, namely your liver and your kidneys. Herbs do not magically act like soap scrubbing your insides, and they definitely cannot bypass or replace your liver and kidney function. At best, certain evidence-based herbs might support your liver function, but they absolutely don't do the detoxing for you.
Which brings us to a really crucial concept, nutritional synergy. Basically, this is how specific herbal compounds interact to effectively complement your diet. Listen, a supplement is exactly that, a supplement. It cannot and will not replace a fundamentally sound nutritional baseline. If your diet is seriously lacking in basic macronutrients and micronutrients, no amount of herbal medicine is going to fix it. Herbs work best when they are introduced into an already balanced system, creating a synergy that truly elevates your overall health.
All right, Section 3, clinical evidence and case studies, the science in action. We've busted the myths, so now let's see what happens when tradition meets rigorous clinical trials.
And this brilliantly illustrates the clinical reality of a few heavy hitters. Let's start with turmeric. It's widely praised for fighting inflammation, but its active compound, curcumin, actually has terrible bioavailability on its own. Your body basically just flushes most of it out. It needs a specific delivery method, like the piperine found in black pepper, or a fat source, to actually absorb into your bloodstream. Next up is ginger. Tradition claims it helps digestion, and you know what? Clinical trials absolutely back this up, proving its benefits for gastric emptying. And then we have garlic. long claimed to help the heart, and the hard science actually shows strong positive cardiovascular indicators when it's prepared and dosed correctly.
Moving along to green tea, clinical evidence pinpoints that specific compounds, like EGCG, actually drive metabolic function. This proves it does way more than just give you a quick caffeine boost. Then there's fenugreek. It's commonly claimed to balance blood sugar, and clinical nutrition trials have demonstrated real, measurable efficacy in glycemic control. Finally, ashwagandha. It's been used for centuries for stress, and modern science has proven it actively modulates the body's cortisol response. See what we're doing here? We're moving far beyond vague historical claims. The clinical reality pinpoints the exact physiological mechanisms.
Let's move on to Section 4, Hidden Risks and Interactions, the Danger of Assumptions. Because powerful clinical effects also carry real clinical risks that we absolutely have to manage.
The absolute biggest danger we face here is drug-herb interactions. Mixing active herbal pharmacology with prescription medications, that is a massive gamble. For example, taking an herb that naturally thins your blood can be disastrous if you're already on a pharmaceutical blood thinner. We also have unintended side effects to watch out for. This is exactly why we must never overstate clinical claims or just ignore clinical limitations. Adding highly active plant compounds to your routine requires proper medical context and, honestly, a whole lot of respect.
This brings us to Section 5, Evaluating Claims Like a Pro. Think of this as your personal toolkit for separating scientific fact from marketing fiction. All right, here is your action plan. First, don't just rely on a single isolated study. You want to look for systematic reviews and meta-analyses, simply because they look at the entirety of the data. Second, always mentally separate a traditional belief from a clinical fact. They are just not the same thing. Third, learn to read research simply and objectively. Keep your eyes peeled for clinical nutrition concepts rather than flashy, hyped-up buzzwords. By doing all of this, you can build truly evidence-based nutritional protocols that actually work for you.
And finally, Section 6, the Evidence-Based Future, where ancient tradition meets cutting-edge technology.
Let's move to and see how this builds. AI and digital healthcare are completely revolutionizing this field right now. Instead of playing a one-size-fits-all guessing game, we are rapidly moving toward highly personalized, evidence-based herbal nutrition. AI can actually cross-reference your specific biological data, your daily diet, and your medications against vast databases of clinical trials. Why? To recommend the exact dose-response relationship you need. It is literally an incredible time for precision in evidence-based nutrition.
I want to leave you with a simple yet powerful rule. Use tradition wisely. Trust evidence responsibly. Tradition gives us these incredible clues about the natural world, right? But it's scientific evidence that gives us the actual map to use those clues safely and effectively. So, based on the evidence-based framework you just learned today, how will you rethink what's sitting in your supplement cabinet tomorrow? Thanks so much for joining me on this explainer, and I'll catch you next time.